Hi students, today let me talk about estimation of blood glucose. Very important practical aspect question. You are having 4 estimations for your university exam: glucose, urea, creatinine, protein. For all these 4 experiments, any one you have to perform in your university examinations. So today I am going to discuss about estimation of blood glucose, right? So how to start and what are all the important points for the estimation of blood glucose? The first one is it is estimation of glucose by autoanalyzer method. Specimen for a patient, you are already advised to go for blood glucose estimation or examination in the lab. Patient come to the laboratory. So what are all the specimens you have to collect for the estimation of blood glucose? The first one is whole blood, second one is plasma or serum, third one is capillary blood. These are all the 3 specimens for the estimation of blood glucose you have to collect. Usually we are doing plasma or serum glucose only. Okay. Second one is, what are all the methods? Which method you are applying for the estimation of the patient's glucose? We have 2 classification. One is enzymatic, another one is non-enzymatic. In enzymatic, we have 2 types, that is GOD-POD method shortly, that is glucose oxidase and peroxidase method. Second one is reference method, hexokinase method. Coming to the non-enzymatic, we have 3 types: Falin-Wu, orthotoluidine, Nielsen-Somogyi units. These 3 are all outdated. We are following only enzymatic analysis in the fully automated analyzer GOD-POD method. Okay, you just know the name. Sometimes in your practical or viva, table viva, some examiners will ask about, tell me other name of the methods available for the estimation of glucose, like that. That time you have to answer Falin-Wu method, orthotoluidine method, Somogyi, Nielsen method. Okay. Next one is, you already know about the glucometer. This is otherwise known as self-monitoring blood glucose, SMBG. This is actually blood, 1 drop of blood from the fingers by glucometer, right? So capillary blood glucometer, strip method. Difference between this venous blood and capillary blood is, in capillary blood the value will be always 20 to 30 is high. 20 to 30 milligram per deciliter is always high in capillary blood compared with venous sample. Next, do you have any preservatives to add for the collection of blood? So patient is coming for giving blood for estimation, glucose estimation. So you have to take the vacutainer or syringe or containers for the blood collection. So here, in nowadays the container already inbuilt method like the anticoagulant or anti-glycolytic materials are available. So you have to correctly pick up the vacutainer, that is container for the blood collection, sample collection. In that vacutainer, what preservative you have to add for glucose? We have 2 preservatives. One is sodium fluoride, another one is potassium oxalate. One action is anticoagulant, that is potassium oxalate, whereas sodium fluoride action is, it prevents the glycolysis. In glycolysis, the main enzyme is enolase, which converts the phosphoglycerate into phosphoenol pyruvate. So the sodium fluoride role is, it prevents the glycolysis, because if you are collecting the specimen, that is blood, in the container, after you leave it sometime in the lab, what happens is the whole pathway of glycolysis will go on and finally the glucose level will be low. This is known as false glucose value. We are actually, our plan is to measure the true glucose value. So we have to prevent glycolysis. That is why we are adding sodium fluoride, which inhibit the enzyme enolase. Very important MCQ question. Sometimes Table wise also examiner will ask sodium fluoride role, potassium oxalate role. Okay. Next one is glucose oxidase GOD, peroxidase POD method. So what are all the subtitles you have to present in your paper? Number one is what is the principle? In glucose estimation, actually we have two reactions. One is glucuronic acid formation, another one is hydrogen peroxide role formation. What is the role of hydrogen peroxide in this glucuronic acid, like that? So you have to mention one reaction for GOD and one reaction for POD. Different colleges are giving different uh, uh, estimation methods, but the reaction is common. One is GOD reaction, another one is POD reaction. Second one is what are all the reagents you have to take for this estimation of glucose? Actually, 4 reagents that in your record notebook or in your manual already it is there. You go through. After this writing the reagent, you have to draw the table diagram. In the table, actually this one is serial number, then blank, standard and test, right? So you should know the meaning of these three. Test means patient sample. You are going to analyze or you are going to estimate the patient's blood glucose value, that is test sample. Standard means already known concentration prepared by your lab personnel or lab staffs. You know the concentration value of that standard, right? Third one is blank. Here there is no reagent, only distilled water, like that. No sample, like that. Distilled water, known concentration, unknown concentration, that is sample, patient sample. Next one is you have to know, you should know about the two important words for your estimation. What is the meaning of stock solution? What is the meaning of working standard solution? Already they prepared one main solution, that is 100 milligram of glucose in 100 ml of benzoic acid. That is called stock solution. From the stock solution, you have to take 10 ml and make it up 100 ml by adding water. This is known as working standard solution. These two words are very important. Definitely the examiner will ask what is the working standard concentration, what is the stock solution concentration, like that. Okay. Here the meaning is 100 milligram of glucose in 100 ml of benzoic acid, whereas here 10 ml of stock solution in 100 ml of water. Right. Percentage is 10 milligram percentage simply. Next one is mix the contents well and go for the water bath. There the temperature is 37 degrees centigrade. The time is 15 to 30 minutes. Right? Usually 15 minutes only the color will come. Then you have to come for the measurement. Here the instrument name is calorimetry. Calorimetry means you have to know the Beer's law and Lambert's law. The principle is Beer's law and Lambert's law. So wavelength is 500 to 530 nanometer wavelength. OD at wavelength of 530 to 500 to 530 nanometer. So you should know the color of the filter, you should know the range of the wavelength, you should know the principles of calorimetry, everything for the estimation of glucose, right? So after this, you are going to calculate the estimation value by using some formulas. We will discuss in the next book. Yes, now you are going to write the formula for the calculation. Concentration of the standard, concentration of the blank and working standard, like that. Finally, you find out one result. Right? After the calculation, application of all the OD value, that is blank value, standard value, test value, applying this formula, you will get one result. So the result, how it will present in your paper. Glucose present in 100 ml of serum is, or glucose present in the patient sample is dash milligram per deciliter. The unit is very, very important. It is 100, 200, 300 or 600. Your results will be, suppose you have to mention 600 milligram per deciliter. Suppose normal sugar value postprandial less than 140, that is 126, means 126 milligram per deciliter. So up to this is the outlines for the estimation of blood glucose. Now coming to the interpretation. Interpretation means your result is normal, high or low. If it is normal means no problem. If it is high means what are all the conditions the patient will get high glucose levels. If the level is low means in which conditions the patient will go for low glucose level. Like that the examiner will ask questions. Okay. Before going to the interpretation, some physiological status, normal conditions, anger, anxiety, fear and epinephrine secretion situations, normally we are having increased amount of glucose. This is for just remembrance. Coming to the interpretation, the normal value is for any compound, for all the 4 compounds, plasma protein, glucose, urea, creatinine, you should know the blood level as well as urinary level of the particular compound. Here the blood glucose fasting level is 70 to 100 milligram per deciliter. Postprandial value is 100 to 140 milligram per deciliter. Random blood sugar is 80 to 120 milligram per deciliter. Like that, you have to write all the 3 values for your normal levels of blood glucose. Okay. Now, suppose the value is 300. What are all the conditions? Hyperglycemia. That is, glucose value is high. Hyperglycemia. You all know the conditions for the hyperglycemia. I am giving in 3 topics. One is infection, usually sepsis. For any sepsis, the patient will go for hyperglycemia. Second one is some drugs always stimulate the glucose level. That is, stimulate the pancreas. Steroids and estrogens always produces hyperglycemia. Some diseases, you know all the diseases, diabetes mellitus, hyperthyroidism, hyperpituitarism, Cushing's, hyperadrenalism, pancreatitis, pheochromocytoma, adrenal tumor. These are all the diseases for the hyperglycemia. Got it? Suppose the level is hyperglycemia means more than fasting is more than 100, postprandial more than 140, random more than 120, hyperglycemia. Whereas coming to hypoglycemia, the level should be 40 to 50 or less than 50, or some book says less than 40. Hypoglycemia cutoff value is either less than 40 or less than 50. So, for this 50 milligram per deciliter of glucose hypoglycemia, what are all the conditions? The first one is accidental ingestion or overdose of insulin. Usually for type 1 patients, already they are taking insulin for their management. Sometimes what happens is 2 times they are giving the same unit of insulin in breakfast time or dinner time or night time. That is overdosage of insulin. Commonest cause. That time only the patient will go for hypoglycemia normally. So overdosage or accidental increased amount of or increased dose of insulin. Second one is, starvation, there is no glucose. Third is secreting insulin secreting tumors, that is pancreatic tumors, obviously hypoglycemia. Next one is hyperthyroidism, here the cause, hyperpituitarism, here the cause, here hypothyroidism and hypopituitarism. Here hyperadrenalism, Cushing syndrome, here hypoadrenalism, Addison's disease. Then von Gich disease in glucose metabolism, that is fasting hypoglycemia in babies, children. Von Gich disease in children, that reflects fasting hypoglycemia. The final one is alcohol ingestion always leads to hypoglycemia, right? So these are all the subtitles for the estimation of glucose. You should know the meaning of true glucose and true glucose. That is, Without any substances interference means true glucose. Suppose for example protein, uric acid, glutathione like substances interfere, the estimation is called false positive glucose. This is actually enzymatic method for the estimation of true glucose value, right?